In this video, we'll talk about hydatid disease, which is caused by dog tapeworm, which is called as Echinococcus granulosus. So here the definitive host is dog, intermediate host is sheep, and the accidental host is man. So what happens here? First, there is ingestion of the eggs in the dog feces by the sheep. So what happens here? Basically, this is the dog tapeworm, right? So this tapeworm will be residing in the dog, and it will undergo sexual cycles and produce eggs in the dog feces. So this feces will be eaten by sheep. So the sheep gets infected with this hydatid disease. So what happens? This infected sheep will be eaten by dogs. So this eggs will be turning into adult tapeworms in the dog's intestine. So what happens again? It will undergo the sexual cycles and it will produce eggs in the dog feces. So if man accidentally consumes any contaminated food with this eggs of Echinococcus granulosus, and so in the man it can enter through the portal vein and it will reach the liver. And also keep in mind, it will also reach the lungs and the brain, right? So this hydatid cyst is a larval stage of Echinococcus granulosus, and the surgery you do for this is paid surgery. We'll talk about it. So coming to the layers of hydatid cyst, we will be having 3 layers. One is pseudocyst, ectocyst, and endocyst. The pseudocyst is formed because of our immune reaction to the Echinococcus granulosus, right? So this is the fibrous layer, also called as adventitious layer or the pericyst. So it is formed by inflammatory reaction of the host or the immune reaction of the host. So it is derived from our own liver cell, right? So it is adherent to the liver and it cannot be separated. So we cannot separate it in the surgery also. So what do we know about the pseudocyst? It is a fibrous layer. It is formed because of our immune reaction, because of inflammatory reaction of host. So it is formed from the liver tissue. So it will be adherent to the liver tissue and it cannot be separated. That is about pseudocyst, which is formed from the man, right? Coming to the ectocyst. So it is a white elastic and it is formed by the parasite. And it is derived from the parasite. It contains a hydatid fluid and it can be separated in the surgery. So the surgery we do for this hydatid cyst is paid surgery, right? So this is the white and the elastic layer which is formed by the parasite. It is derived from the parasite, so it can be separated in the surgery. So ectocyst is formed by parasite. Coming to the endocyst. It is the germinal epithelium and it is the only living part of this hydatid cyst, right? So it is secreting this hydatid fluid, and also it has the brood capsules and the scoliosis. Scoliosis means the head of the future worm. So what will be seen in this endocyst? First, you will be having all the brood capsules and the heads of this future worm, right? Scoliosis. So that is why it is the living part and it is the germinal epithelium. So it secretes this hydatid fluid. Now if you look at the diagram, this outermost covering is the pseudocyst. So pseudocyst is formed by fibrous layer. It is derived from liver tissue because of the inflammatory reaction, right? So it is also called as adventitious layer or the pericyst. So that is about our pseudocyst, which is derived from the liver and it is adherent to the liver. It cannot be separated in the surgery. Now coming to the next thing, which is ectocyst. So this ectocyst will be surrounding this endocyst. So what does this endocyst do? It will produce hydatid fluid. So this ectocyst will contain the hydatid fluid, and also it is whitish in color and it can be separated in the paid surgery. So that is about our ectocyst. And coming to the endocyst, again it produces this hydatid fluid and it is the only living thing. Why it is the only living tissue? Because it has all the brood capsules and the scoliosis. You can also see this brood capsules which is attached to this endocyst and also daughter cyst. And these little things are the heads of the future worms, which is called as scoliosis. Now if you look at the clinical features, the cyst can either undergo calcification. So in that case, the clinical features are not much seen and also the treatment will be conservative. And in the other case, the cyst can get enlarged and it will be palpable per abdomen. And it usually enlarges in the right lobe of the liver as it enters through the portal vein. And the cyst can compress bile duct. So this enlarges to a certain level that it can compress bile duct, which can cause obstructive jaundice, right? So it compresses this bile duct. And the next thing is, I have said this enters through the portal vein into the liver, or else it can also go to the lungs and the brain, right? So here you can see this pulmonary cyst which can cause cough, chest pain, hemoptysis, that means blood in the sputum. So CNS cyst, you can see epilepsy and the blindness, right? It compresses this optic nerve and it can cause blindness. And the cyst can either undergo calcification or it can enlarge and cause all the symptoms, and it can present in various sites, or else the cyst can also rupture. So in case of rupture of hydatid cyst, you will see this fever because of all the inflammatory reaction. You can see the fever, pruritus, itching, urticarial reaction because of the foreign antigens, rash, anaphylactic reaction, and it can also be fatal condition. So this happens in the rupture of hydatid cyst. And also secondary infections can be seen, super infections and suppuration can be seen, and hepatic dysfunction, disseminated abdomen hydatidosis, that means it is spreading throughout the abdomen. So either it can go undergo calcification, or it can enlarge and compress this bile duct. It can also go to pulmonary area and CNS also, or else it can rupture and causes all this anaphylactic reaction. The patient will be experiencing dragging pain in the right hypochondrium because of the liver. When the cyst is present on the liver, there can be dragging type of pain, and also hepatomegaly because the liver is enlarging, so palpable mass per abdomen you can see. Typical hydatid fluid trill is also seen. What happens, over the cyst you place your 3 fingers and percus on the middle finger. You can feel the trill in the other 2 fingers, so that is typical hydatid fluid trill you can see in this hydatid cyst. And also dyspepsia, and if in case the cyst goes to the lungs, it can cause cough, chest pain, and the pleural effusion. The cysts are going to the brain, it can cause seizures and the blindness. Anaphylactic shock in case of rupture of hydatid cyst, and cataxia. Jaundice and cholangitis can be seen because this cyst enlarges so much that it can compress this bile duct, which can cause obstructive jaundice and the cholangitis, right? So this is about the clinical features. Now if you look at the diagnosis, you can do a chest x-ray to see for any pulmonary cyst, and also you can do CT scan or MRI to see for any brain cyst. QSG abdomen can be done to locate the cyst and to know the size and shape of the cyst and all. So investigation of choice nowadays is CECT, contrast enhanced computed tomography. So honeycomb and water lily signs can be seen in hydatid cyst. If we talk about other 2 signs, one is crescent or the meniscus sign, and the second is water lily sign. So crescent or the meniscus sign is because of presence of air between pericyst. Pericyst means the outer pseudocyst, right? The pericyst and the laminated membrane. So presence of air between this pericyst and the laminated membrane will be looking something like a crescent, so it is called as crescent sign. What is present? The air is present, right? So this in the meniscus sign or the crescent sign, there is presence of air between the pseudocyst and the laminated membrane. Now coming to the water lily sign, the endocyst, that means the inner cyst, will be floating in the partially fluid filled cyst. So that is known as water lily cyst. It can be seen in the CT scan. So what all you can see in the CT scan? You can see this honeycomb appearance, water lily sign, and the meniscus sign or the crescent sign, right? And also apart from all this, you can also do ELISA, PCR, X-ray, liver function test, MRI, Cassoni's test also can be done, but it is not done nowadays. Now coming to the treatment, you have to give albendazole 400 mg for 3 months. Metronidazole can also be given. If albendazole and metronidazole are contraindicated for any condition, you can also go for praziquantel, right? If there is any calcified or the dead cyst, I have said before, we just don't do anything, we just wait and watch. So there will be conservative treatment. And the surgery you will do in this case of hydatid cyst is a paired surgery. What do you mean by paired surgery? It is a puncture, aspiration, injection, reaspiration. So you puncture and then you aspirate the content, that means a hydatid fluid, and then you inject scolicidal agents, because this endocyst will be having scoliocytes, right? So it will be having head of this future worms. So to kill that, we will inject the scolicidal agents like hypertonic saline, and then again you will reaspirate till you find the clear fluid. So this is the paired surgery. Indications for the surgery: if there is any symptomatic cyst, you can see all the symptoms, and asymptomatic cyst which is greater than 5 centimeters and it is also not getting calcified, and also any infected cyst. So in all these conditions you can prefer this paired surgery. Now coming to indications for the medical treatment. So there is disseminated hydatid cyst, so we cannot go and remove everything from the body, right? So, and also in the deep seated, multiple or the recurrent cyst, surgical interventions can cause rupture of the cyst, so that's why we plan for medical treatment. And also if there is any cystobiliary communication.